Welcome to Spectrum Health Services, celebrating 50 years of healthcare services to the residents of the city of Philadelphia. Our journey started in 1967 when a group of prominent citizens and community residents incorporated as a not-for-profit 501c3 to provide family planning services and information to all residents of Philadelphia. They were joined by a board of directors, Bishop John D. Bright, Dr. Leonard G. Carr, media personality Trudy Haynes, and the Honorable Sarah A. Anderson.
Spectrum Health Services is in a group of primary care providers that were established as a result of Lyndon Baines Johnson's War on Poverty. There were many communities across the country where their primary physicians were leaving.
Services were established in up to 9 locations: Sarah Allen Medical Center, Greater St. Matthew Medical Center, Christian Street Medical Health Center, Clara Baldwin Medical Health Center, Haven House Medical Health Center, Broad Street Medical Health Center, and the Jones Memorial Medical Health Center. Carolyn G. Baxter, the 30-year executive director, and the board. After much contemplation, it was decided to consolidate the multiple locations and establish a site to provide the desperately needed range of primary care in one location. Mrs. Baxter solicited the support of her healthcare partner, Dorothy Mann, to submit an application to DHHS to receive funding in the Haddington section of West Philadelphia. With the award of grant funding in 1983, Spectrum became what is known as a federally qualified health center, with the mandated mission to provide access to care to individuals regardless of their financial status. Other milestones during Spectrum's 50-year service include, in 1991, Spectrum established the first in-house school-based program named the Schultzberger Personal Examination Center, also known as SPEC. The center provided physical examinations, immunizations, and treatment of acute conditions to registered students who attended the Mayer Schultzberger Middle School in West Philadelphia. Having outgrown the Haddington location, the administration and board of directors took a bold step to embark on a quest for a larger facility. In 2003, while the process of developing plans for the larger facility, Carolyn G. Baxter died suddenly. Her untimely death put a hold on the fulfillment of this vision. In 2004, after an extended search by the board, Phyllis B. Cater, a seasoned healthcare administrator from Boston, Massachusetts, was appointed as the chief executive officer to lead the center and pick up the banner to find a new home for Spectrum.
Ms. Cater is an A1 leader. She's very busy, and I would say I'm all very busy, but the thing about Ms. Cater can get it done.
In 2007, with the identification of an adequate location, Spectrum began to campaign for financial support for the construction of the new site.
Spectrum at that time needed some financial help, and I was on the finance committee. Once I realized what Spectrum did, I came and met the people at Spectrum. Soon after, I was invited to be on the board.
After the groundbreaking, the new 36,000 square foot facility opened in 2013.
Yes, there's refreshments. Please help yourself. There are tours of the building. Please make yourself at home.
I felt I had a level of satisfaction that I hadn't known before, because I wasn't sure I was going to be able to do it. There were 2 things that I felt good about. One was that I was able to establish the relationships that were necessary to get the resources and to get the support of individuals that I had only known for about 4 or 5 years to trust me enough to build something that was this important.
With the construction of the LEED Silver certified facility, Spectrum was able to triple its capacity to deliver care with the creation of 32 exam rooms. Additional new features at this location included the construction of 8 operatory state-of-the-art dental suites.
It's one of the areas in medicine that has been a lot of a challenge in terms of getting people to understand the link between oral health and physical health. So Spectrum is trying to be cutting edge in that regard.
You have providers who have been trained in some of the best educational institutions in the country who provide excellent quality service comparable to any healthcare service in the United States.
A demonstration kitchen and an 80-seat room to host educational meetings, forums, community support groups, and trainings. Spectrum's new site will support the expansion of services in the future years. More recent milestones include the opening of a 10,000 square foot site in South Philadelphia and recognition by the National Committee on Quality Assurance as a Level 3 provider.
Places like Spectrum become so important because it's not just one thing, it's many things once you come into our doors that we are able to address, and if we don't know, we will find out.
From my standpoint, it is the best thing that can happen to this community. We are reaching out to the community, and the community when it is embracing us now.
They saved my life. I walked from my house on 58th and Arch up to Spectrum Health Services, and I was seen right away, and they let me know that I was in respiratory failure. So I basically could have lost my life and not been here today.
We're all together needed to make a community that has a quality of life where people can feel fulfilled and satisfied and support themselves and their family.
The vision of Spectrum Health Services is to work in partnership with others to provide a network of quality health care and needed services for the next 5 generations of residents in the communities that we serve. As we celebrate Spectrum Health Services past, present, and future, we honor 50 community gems who have also worked tirelessly to build and sustain healthier communities throughout the city. Our sincerest thanks and gratitude goes to those individuals who have served faithfully as members of our board of directors over these past 50 years. You are Spectrum Health Services.